Well, the main difference is that these are community clinics. So we take HIV care to the community. So we have 5 clinics throughout the city of Chicago and the main hospital-based clinic. So what we did was to compare the outcomes, the virologic outcomes of patients treated at those clinics to the patients treated in the hospital. The patients at the clinics were more likely to be uninsured, underrepresented minorities. They were more likely to be homeless or be lost to care for more than a year. So despite having all these adversities, I mean, the care was similar. And I think that has to do with all with the team we have, the outreach team that we have, that gets these patients wherever they are to try to get them care. And I think we call it the indigenous leader outreach model. So they're basically people from the community who serve as peers, and they bring the patients to care and they follow up on them and stuff like that. So that kind of intensive outreach, I think, is what makes this model successful. We partner with the Community Outreach Intervention Project of the University of Illinois. It's a model called the Indigenous Leader Outreach Model, which was pioneered by them to target and to bring to care IV drug users. And so we co-locate our clinics, our neighborhood clinics, with this project. They provide the HIV testing, clean needles for persons who inject drugs, etc. And then that provides for easy linkage to care of our patients if they turn HIV positive or Hep C positive. And so, but they also serve another function, is they're recruiters. They're, they go find the patients wherever they are. So even if we have, for example, homeless patients, I mean, our outreach workers, which hail from the communities where we have these clinics, they know where these patients are, and they can go get them and bring into care. They can get medications to them. They provide, bus passes, meal vouchers if they need to. So we think that intensive street outreach makes a difference when you're dealing with bringing to care hard to reach populations like the ones we deal with in inner city Chicago.